Namaste students, Khushra Betian. I, JPM Dr. Y. Chandrakala, Assistant Professor Jyoti Vidyapeeth, Women's University, Jaipur. In today's session, we are going to discuss about the cancer. What is cancer? Cancer is an unregulated or a proliferation or a growth of cell arising from cell of specific organ. General name for a group of more than hundreds of diseases, although many kinds of all starts because of the abnormal cell growth or a proliferation or an uncontrolled cell growth. Cancer cells have the ability to create their own blood supply, break away from the organ of origin, travels, and spread of other organs of the body. Morbidity or the mortality arises from the predominance from the organs or a damage caused by the local growth and metastasis to the distant anatomical structure. The cancer cells are based on the cancer cells or the normal cells. So the normal cells are known to stay in a place of origin or known when it to replicate or when to die. But a cancer cells don't know when to stop the growing and proliferating. They can travel or metastasis size from organ to the origin from origin to any place within the body. So how a normal cells become cancerous? What happened to the cell of that allow a cancer to develop? So the multi steps of initiation of a normal cells when exposed to a cancer or a carcinogenic exposure to a chemical, a radiation or a virus, etc. That cell initiate the cell division, which have a selective cloning exposures and then forms the paraneoplastic lesions, which forms the initiation to the promotion and progression. Progression leads to the malignant tumor that forms the metastasis. Okay. So the major risk associated like genetic predisposition or tobacco use or alcohol excess that can be the factor or lack of physical activity or environmental and diet or the virus or exposure to sun also sometimes cause certain problems. The major type of carcinomas like adenocarcinoma, any gland that is breast, prostate, lungs, or a pancreas, or a ovary, or a colon, that may be under like adenocarcinoma, like squamous cell carcinoma, that may be called as when any surface or a lining of a mucous membrane, that is skin, lungs, head, or a neck, or other like bladder or pancreatic cancer carcinoma. So the like here the lipomas or leukomas here, liquid or tumors, tumors of lymph nodes or blood fluid cells. So the type of lipomas are Hodgkin's lipoma or non-Hodgkin's lipoma. So the characteristic of Hodgkin lipoma is the appearance of the clinical presentation or specific type of cells or various types or a specific response has to be here taken care of. The leukomas or a malignant cells arising from cells of the bone marrow, white cells, red cells, platelets, or plasma cells. Or sarcomas where arises from a soft tissue or a bone, wide spectrum of the site of presentation. Uh, Osteosarcoma, which is from the bone, chondriosarcoma of the cartilage, or synovial cells of the sarcoma, or the liposarcoma for the fat. So, how a cancer is diagnosed? There are certain warning symptoms can be found in the when a person is suffering from a cancer, like coughing, rectal bleeding, or palpitation of the breast pump, lumps like feel it, or weight loss, or a skin abnormality, change in the mole, or red airness in the area, or coughing of blood, or chest pain, change in the bowel habit, or abnormal pain, or like blood in the urine, difficulty in swallowing, hoarseness. So certain different kind of symptoms can be found depending upon the type of the um, cancer. So like asymptomatic, like blood test from or using marker or screening study of PAP as PSA or colonoscopy, mammograms or total blood body CT scan, radiography or surgical biopsy, or then leading to other pathological tests which can diagnose. Or so normally cancer spread through the metastasis, where the benign cells or malignant cells, the initiation or a conversion to the inversion, and then to the extra movement of the this tumor cells to the different part of the organ. The process of finding out how far the cancer has spread has a vital role in determining the treatment or a choice of giving a clear idea of the outlook of recovery, where the TNM system is used often, or a biopsy, or a CT scan, or MRI, or PET, or ultrasound, or a blood test can help in determining the stage. Staging use the TNM or a grouping staging, where the tumor cells or the nodule or a status or the presence or absence of the metaphase uh, cells, or like degree of differentiation can be found. Thank you. This session is powered by 2.0 Vidyapeeth Women's University, Jaipur. If you have any queries, we'll discuss in the problem solving session.